Hello, everyone, and welcome to BDT's webinar introducing our data sharing playbook. I'm Bridget Gibbons-Strawn, Government Innovation Manager, and I'll be kicking us off with a few reminders before we jump in. We're so excited you're able to join us today. Please note that this webinar is being recorded and will be uploaded to our website to serve as a resource going forward. We'll also circulate this recording to all individuals who registered for today's event. If you are experiencing any technical issues, please reach out to BDT's tech services by emailing Brian Sharp, whose address is on the screen. We welcome your questions about the playbook, data sharing, or our panel's experience. Given the size of the webinar, please share those questions using the Q&A feature at the bottom of your screen. During the Q&A section toward the end of the webinar, we will address as many questions as possible. If we don't get to your question, you can email it to us at the address you see here. Please note that there is live captioning available. You can access this feature by clicking Caption at the bottom of your screen. Now I'm going to kick it over to Trooper Sanders, BDT's CEO, for opening remarks. Thanks so much.
Hello, thank you, Bridget, and for all your hard work across many things across BDT, but especially for today. Well, everyone, welcome. Welcome to this webinar. Welcome to the Benefits Data Trust virtual living room for the next couple of hours. This is indeed an exciting day for BDT. The work that has gone into this playbook, and then before that, a lot of the hard work and thinking and expertise and battle scars and hard lessons around data sharing that has led to creating this resource and today's webinar, and also the ongoing conversations and support that will extend beyond today. It's a wonderful celebratory day for my colleagues and me. I really want to thank everyone for being here, but I especially want to thank the public servants all across the country who are joining us today. We all know that public service in normal times is, while it's a labor of love, it can also be quite challenging meeting the demands of residents across your states and cities and counties. And then during extraordinary times, such as we have been in for the past several years, makes it even more challenging. And so the fact that you can take time out of your busy day to both join us here, but then to also take time out of the so many things that you have to do to devote some energy to digging in on a topic, a nerdy topic, but an important topic such as data sharing is really, really welcomed. And for my colleagues and me, since really the beginning of BDT being founded in 2005, we really see ourselves as working with public servants and others across the country at the crossroads of today's hard realities and practicalities of making things work for people and realizing tomorrow's possibilities, and working to ensure that all of those who are eligible for benefits and who want to receive them have an easy and dignified experience, supported by public servants and others whose day jobs are made more efficient and more satisfying because these efforts are improving. And while data is in BDT's middle name, our expertise and experience around data sharing did not happen overnight. And it really started with work right here in our home state of Pennsylvania, and working with an extraordinary public servant, Tom Sneddon from the Pennsylvania's Department of Aging, when many years ago, BDT, one of the first big efforts that we were involved in, was helping seniors across the state of Pennsylvania tap a really innovative prescription drug assistance program that's available. And data sharing and matching was a really important part of that. And it not only has allowed us to improve the lives and health outcomes of hundreds of thousands of seniors across Pennsylvania, but to really uncover the power of data sharing, particularly when it's matched against such a large issue that benefits access can be. And of course, when you're trying to get your participation rates up and reduce churn and make sure that there's sustainable support out there, the first question is, how can you possibly meet all of the need and the gaps of engaging people and reaching people and find people who are eligible and need help? And data sharing is one of those ways that is effective, that's efficient, and the efficacy has been proven. But of course, to make that happen, there are a number of legal and technical issues that are really important to focus on as part of responsible data sharing and data use. And that's why we're here today. And I'm just so proud that this playbook will be of service and helpful to folks across the country to advance or begin their data sharing journey, and that it will have the type of impact at scale that will make a difference, not only about data and programs, but we are all here because ultimately we want to improve the health and education and economic and equity outcomes for families and households. So I will stop there so we can get on with the show. Again, I want to thank my team for all of the hard work and commitment that has gone into it. And I am pleased to turn things over to my colleagues, Jeneé and Alissa, who were the extraordinary authors of this playbook. Thank you so much.
Hello, I'm Jeneé Saffold, policy attorney with BDT and co-author of the Data Sharing Playbook. We'll go over today some of the highlights of the playbook and what you can expect to find in there, in case you haven't had the time to read this lengthy resource just yet. We created this playbook as a how-to guide for using data sharing for analysis and outreach to, as the title implies, make benefit systems more effective and efficient. It's primarily written for city, county, and state government agencies that administer benefits, but its usefulness definitely extends beyond that to groups in other sectors like healthcare, higher education, and community outreach partners. We conducted interviews with 35 city, state, and federal officials and other experts in the data sharing space. Combine that with BDT's nearly 20 years of experience in data sharing to help answer a lot of the common questions we've encountered in doing this work. The playbook is intended to cover the gamut of data sharing experience. Whether you're a novice or an expert, we believe that you will find something useful in this resource. And we looked at your responses to the webinar sign-up poll. And as you can see from this slide, we have a wide range of data sharing experience represented in our audience today. And so we hope that you will find our playbook to be helpful wherever you are in your process. Just so that we're all on the same page about data sharing for analysis and outreach and what we mean when we say that, we're talking about sharing and matching data about benefit participants across programs. It's a powerful tool for increasing efficiency and uptake of benefit programs and closing participation gaps. It can allow agencies to identify individuals who are eligible but unenrolled in benefits, understand gaps and disparities in access, and use outreach to help eligible individuals connect to and maintain their benefits. What we've consistently heard in our interviews and our own experience is that navigating the law is the biggest barrier to successfully engaging in this work. And there are endless possibilities of ways that you can mix and match federal benefit programs for sharing data, but the law is the main gatekeeper for what you're actually allowed to do. I tried to be pragmatic in drafting this section so as not to give the impression that the law always says that you can share data, because that is simply not true. But also relaying that there are instances where the law allows you to share data for analysis and outreach purposes. And even if you were told you cannot move a project forward, there may be ways to structure the data sharing differently to get to a yes. Because the answer under the law is always dependent on what is the purpose of the data sharing. Different purposes will have different conclusions under the law. The playbook includes background on legal, privacy, and security issues so that programmatic staff can have productive and informed conversations with those teams. There's information on federal law for 5 benefit programs. Those are Medicaid, WIC, LIHEAP, SNAP, and unemployment compensation. Information on federal privacy laws that pertain to those benefits like HIPAA. We've included information on the Telephone Consumer Protection Act and texting. And finally, some common data sharing agreement components. And with that, I'll turn it over to my colleague, Alissa.
Thanks so much, Jeneé. I'm Alissa Weiss, Director of Government Innovation and co-author of the Playbook. So in addition to the legal, privacy, and security issues that Jeneé covered, we know there are a lot of operational considerations that can really make or break a data sharing project. The Playbook includes tips to make this process as smooth and efficient as possible. And here are some of our favorites. Tip 1. Connect early and often with key team members from relevant agencies as you build your initiative. In our experience, you need program and operations, legal and privacy, and data teams from both agencies to be aligned, because if not, it will lead to delays. Throughout our interviews, we consistently heard the same message. You can do this work without high-end technology, but you cannot do it without trust and communication. Tip 2. Spend time planning which data fields you need to conduct and evaluate your intervention so they're included in your data sharing agreement. So for example, if you want to send text outreach, the DSA will need to include access to cell phone numbers, and you need to think about that before you execute your agreement. Tip 3. Data sharing for analysis and outreach is an opportunity to build equity into your work, but you can only do that if you include demographic and geographic fields in the data sharing agreement. This allows you to understand disparities in access, build interventions for different populations, assess who those interventions are and are not working for, and make adjustments along the way. Tip 4. Take the time to learn how each program defines and formats the data that will be used. For example, investing in conversations about whether you and your sister agency format the birth date column the same way will absolutely make the sharing, matching, and analysis process easier. Tip 5. There are incredible possibilities for scaling the impact of this work when collaborating with healthcare, higher education, and other key sectors. Imagine the potential of Medicaid managed care organizations throughout the country performing SNAP outreach to their members. There's a whole section in the playbook dedicated to these kinds of partnerships. Tip 6, last but not least, don't start from scratch. Whether you're building off existing data shares that your agency has in place or using some of the shells and examples in this playbook as inspiration, you don't have to recreate the wheel. Today, we wanted to give you just a taste of what's in the playbook before we start the panel. Throughout this project, we really sought to lift up our data sharing experiences and highlight different data sharing activities that are occurring throughout the country. But we know this may not track to how your teams have always approached data sharing. And so we really invite you to reach out to us, share your experiences, your questions, your challenges, barriers, and opportunities you may have faced along the way, so we can support you in these efforts moving forward and help collectively build a stronger benefit system. So without further ado, I have the absolute privilege of kicking off our panel, and I'll start by introducing our wonderful panelists. These are short bios that I'm sharing that only begin to cover their accomplishments and the work they've done to advance benefit systems. So first, Shavana Howard is currently the Assistant Secretary of Family Support for the Louisiana Department of Children and Family Services. But just last week, we were all thrilled to hear that she was appointed to serve as Senior Advisor for Food, Nutrition, and Community Services at the USDA. Congratulations. She has more than 21 years of public service in both Washington and Louisiana, and previously served for 6 years in the United States Navy. Tayyab Walker is the Associate Commissioner of Data Engineering and Governance within the New York City Office of Technology and Innovation. Prior to this role, he served as Director of Enterprise Data Solutions within the Mayor's Office for Economic Opportunity, where he developed a strategic technology and policy framework to support numerous cross-agency data efforts. He has held various leadership positions within public, private, and nonprofit organizations. Last but certainly not least, Lorelle Yuen serves as a project analyst for the data office at the North Carolina Department of Health and Human Services. She previously worked as a data and information management officer for the United Nations Migration Agency. So we have a wealth of expertise with us today. So with that, we'll get started. With just a quick sentence or two, I would love to have each of you tell us about your role, particularly with respect to data sharing at your agency. And I'll go in reverse order of the bios. So Lorelle, would love to have you kick us off.
Sure. Hi, everybody, and thank you so much for having me here today. So in terms of data sharing, for the projects that I work on, I help teams navigate through the data sharing process and also liaise with legal to make sure the proper agreements are in place. And before this, before we had our data governance team on board, I played a bigger role in terms of streamlining processes to track data requests, as well as shepherding data requests from A to Z for external requests we received.
Thank you. Tayyab.
All right. Good afternoon, everybody. So my role currently and at the New York City Office of Technology and Innovation, I manage a number of cross-agency data sharing initiatives, and I've built upon the work that previously did it in the Mayor's Office for Economic Opportunity to basically support agencies that are trying to come together to do different data sharing types of initiatives. Everything from finding data for outreach to helping to get data to broker to help expedite clients get access to information and identify people who may be most likely eligible in very unconventional ways sometimes.
Terrific. Shavana.
Hello, and I'm so happy to be here. Thank you for having me. As the Assistant Secretary, especially overseeing a plethora of programs within our department, I really use data a lot and really to tell our story, to ensure that there is equity in the policies and programs that we implement and the practices that we have in operating our programs, to really understand where the needs are, and also what additional resources and support that we really need from other state agencies in order to really be to provide the best services that we can. So it's a lot of trying to understand the need within our state, within the citizens that we have that really need our access to our programs, and then understanding what are the barriers that are interfering with us actually providing those services, and then entering into data sharing agreements so that we can meet the needs of not only the people that we're here to serve, but also other Louisianians who are trying to get services under other programs in which we can use our data sometimes, often to even confer eligibility.
That's great. So I think everyone can see we have some leaders in really complementary roles who have a lot of terrific experiences and perspectives to share today. So Shavana, I'll start with you. Why do you think data sharing for analysis and outreach is an important strategy, and how have you seen these strategies be successful at the Department of Children and Family Services in Louisiana?
You know, as a state agency who's tasked with really providing resources, support, and services for the individuals who are in need, especially a state that has such high poverty rates, you know, it is a lot of work to really ensure that we're able to reach the individuals who need our programs and our services. At DCFS, you know, we not only operate SNAP, but we have our TANF programs, child support programs, workforce development programs, and all of these individuals are trying to access resources, programs, and services. But within this state, it's a very, very rural state in some instances where there's a lot of challenges we have with people accessing those programs and those systems. So there are often times that people just don't even know what is available and how to access the programs and the services. So we've been really focusing on doing some intentional work over these last several years of really understanding what is the data saying and making sure that we have good data in order to move policies and practices forward. Probably about a year and a half, 2 years ago now, I had the opportunity of attending a presentation that was being done by Urban Footprint, in which they were talking about some work that they were doing in California and really trying to help with the housing market and trying to ensure that individuals who needed support in accessing housing services actually had access, and we can do intentional outreach. And so it really got me to thinking of Louisiana being such an impoverished state and how we are addressing food insecurity in our state. And so using their data, we've been able to partner with Urban Footprint, using their data to really tell the story of who we are serving within our state, and then additional services and areas we need to do intentional outreach in our state. And that's some of the challenge. A lot of the states who run SNAP programs, we have SNAP outreach contractors and we do SNAP outreach work. But our outreach partners really like to have some intentional data to show where do I need to go to really find the individuals who really need the supports and services. And that's the great thing about data and working with Urban Footprint is we're able to use their data using a kind of like a Tableau model, if you will, to actually hone in on the zip codes within our state that are truly the most food insecure. So the contractors that we partner with who are actually bringing folks onto our programs can do that outreach for those program areas so that we can be very intentional on who we're accessing and trying to get those resources for. It's like I said earlier, we also have a very rural state, right? So we have a lot of areas that don't have any broadband or connectivity at all. And so it is more or less, how are we being strategic and making sure that we're increasing or changing how people can access our programs in those areas, right? So we can't expect you sometimes to go to an office if there's not an office in that area, but maybe we can send a group of staff to an event in that area when we know there's a lot of people that's going to be there so that we can actually help bring some access to those program areas. And then additionally, we've done a lot of other work, like on the disaster front, as you know, in the state of Louisiana, we have been unfortunate, especially as of the last couple of years, of having a lot of disasters that have impacted our state. And so we use data a lot and really trying to operate a disaster program for SNAP during the midst of a pandemic was a heavy lift. And really, we were trying to figure out how we able to do it. And we were able to really rely on relationships that we've had with other state agencies like Office of Motor Vehicles, like Office of Technology Services, so that we can enter into data sharing agreements to use their data so that people would have to come into our offices and we can actually provide disaster SNAP benefits virtually, which is what we did for probably the last 2.5 years. Instead of having staff or clients come into our offices during the pandemic to keep individuals safe, we were able to enter into data share agreements to still provide those services and have access to all the systems that we need so that we can make eligibility determinations. And so it's been a huge help, a huge lift on these data sharing agreements and MOUs to get in place, but definitely worth the time it's taken and the effort we put forward. Just with moving towards this virtual process, this has really allowed us to share not only with other state agencies as far as our data, but also to rely on other states to support Louisiana when we are impacted with disasters.
Thanks so much, Shavana. I heard a lot in there about, the efficiency of data sharing, being able to reach people who may not know that they're eligible or who may be interacting, having challenges interacting with multiple parts of the system. And we very much agree that, data sharing can be a really terrific way to kind of cut through some of that and reach people effectively. Lorelle, I would love to have you tell us about the SNAP WIC Medicaid cross-enrollment project you've supported at the Department of Health and Human Services. What are some of the challenges and solutions you've encountered in your role implementing this and other initiatives?
Sure. So with this project, just to give a little bit of context, we're trying to understand who in one program like SNAP or Medicaid may be eligible, but not yet enrolled in another program like WIC and vice versa. And just to give a sense of volume of impact that this could have if we did this data sharing, data matching and sharing, we found a cross enrollment gap of up to over 90,000 folks from SNAP and Medicaid that were likely eligible for WIC but not enrolled. So that's a huge opportunity there for cross enrollment. So in terms of some of the challenges that we encountered, I'll talk about two main ones. So with regards to data sharing, we didn't have yet in place our intra-departmental memorandum of understanding and data sharing agreements in place yet, as Shavana was talking about how that really speeds up efficiencies. So we actually had to execute a new data use agreement for this project because it involved 3 different data sets across multiple divisions. And because the law is the gatekeeper, as Jeneé mentioned in the intro, we really needed to get super crisp in terms of our project design. What exact data elements do we need? Which one? Why do we need these? How are we going to share this? Where is it going to be stored? Who needs access? All these details, as well as understanding permissibility with regards to outreach. Can we outreach to individuals or households? Can we send an SMS text message from the state, or does it have to be through a vendor? Can the counties? All these questions we had to sort out. So a lot of these things we already knew, but others required some research and a lot of digging as well. And the devil's always in the details. But I felt we had a lot of things working in our advantage that really helped us to succeed in executing this data use agreement in a relatively short period of time. It took just slightly over 1 month, which was a huge win because I have worked on agreements in the past that have taken up to a year. And I think some of the successes owed to this, it's one, we had really strong backing from leadership at the top levels to prioritize this project. And two, we had a great team and a dedicated point person to really convene all the necessary stakeholders at the outset of the project. So all the project folks, all the data owners, the lawyers from the different divisions, the business folks, et cetera, so that we were on the same page. And that really saved us a lot of time. And we also had some templates in place. We had a data request form that has been pre-vetted by legal before. So it helped us to already think through all the data elements we needed, why we needed them, how we were going to share that, et cetera, so that we were able to come to legal with a lot of the answers already answered to make that process more efficient. And I'll mention one more challenge as well. And this isn't necessarily related to data sharing, but the essence of why we're sharing this data. So this is more with regards to the actual data matching process, because we want to be able to determine who is likely eligible, not enrolled. And as well, we are trying to automate this so that we can repeat this over time. And this is what I call, it was a mind gymnastics exercise because of the different definitions and eligibility rules across the different programs. We were focused on WIC, SNAP, and Medicaid. For example, household is defined very differently across these programs. WIC, it's based on who lives together. SNAP, how you prepare food. Medicaid, more so around tax filing, so you can understand the implications and all these nuances that make it tricky when we are trying to do the data matching and eligibility determination, or estimating that whether they're eligible or not. Citizenship too, that was another one. WIC doesn't require, but the other two programs require that, as well as like some certain immigration status that had to be in place. So this really required, and I liked how this was stressed in the tips. I think Alissa covered this earlier about really like, you have to get together early on to really understand the nuances and the intricacies of the eligibility rules across this program. So we spent a lot of time with all the programs and across the programs, making sure we were all on the same page, because this really helped us to capture all these nuances. And we put this in a big matrix, all the eligibility requirements and the confidence levels for each of them. And that has really become the bedrock to develop that logic for our automation work to make sure this can be a repeatable process.
Well, this is amazing. I feel a little bit like you just described every tip we had in the playbook very quickly. So that was kind of amazing. I also noticed a lot of us nodding our heads, and I can only see 4 of us, so I can imagine what the audience is doing. So thank you. That was really illuminating, and I think really tracks to share a lot of shared experiences with data sharing. Tayyab, you have led amazing tech and data infrastructure initiatives that have really helped advance secure data sharing. How has that technology really helped address barriers to data sharing? And what do you see as some emerging best practices that enable agencies to do this work?
Yes, first off, I'll say that I love the fact that I'm following Shavana and Lorelle, because everything they've talked about really has kind of influenced sort of the approach to kind of technology approaches toward supporting data sharing initiatives. And I would just start off with a quick anecdote, because Lorelle mentioned about data sharing, getting an agreement in a year. So one of the first big projects that had a lot of big spotlight on it. I mean, all the biggest players in the room, everybody, the use case was compelling, all the lawyers were in the room. I was in the room to support sort of the technical approach to it. And to make a long story short, 15 months of negotiation to get to the data sharing agreement. To do the data match, which took 2 hours, and an hour of that was spent trying to connect one of the data providers to the SFTP folder. And they said, okay, we can't, that was kind of an aha moment of sorts, in a sense that what can we do here, or how can our approach to technology not just sort of be ready to do data matching, which we do a lot of, but is there something about the way in which we approach that can actually speak to some of the concerns that came up in that negotiation? Can think in advance about that. And so it took quite a while for me to get to the point and realize that, what we're trying to do is actually come up with a privacy first approach to sort of data sharing. A lot of times within our data sharing agreements or with our technological approaches, we'll use words like, making sure that there's encryption, making sure, we'll lay out kind of data use and all of these things in there. But often what ends up happening is, I would say like it's almost like sort of the classic riddle of the farmer with the chicken, the fox, and the corn, and you got to cross the river, but you only got 2 seats in the boat. And so, for us, these different data sharing types of arrangements, where you have, there may be a permissible route to that that's very easy seen. The use case may be there, but you've got 1, 2 or more agencies that now have to kind of think very smartly about the fact that in our traditional data sharing methods, we've got to I've either got to disclose all of my data to you to get to that kind of common point, or you've got to disclose it to me. And then there's got to be kind of work, and then what all happens in between that. So, in thinking about this, we had, at the work that I've done here in the city of New York, and had the pleasure of doing at the Mayor's Office for Economic Opportunity, which you've graciously highlighted in the playbook, was that we said, hey, we built a matching platform. Why can we think about how we make this a bit more accessible, and how we think about what the lawyers, let's listen carefully to what the lawyers are saying and what the big concerns are. Let's understand sort of what social service law, the concerns are there, and think about how well is our kind of technology approaches aligning with that. And so in short, I will say the approach, our technology platform has had a few principles up front at it. One, how can we minimize disclosure? And so, is there a way? So we've built like a matching platform that basically allows, an agency to kind of, if with a legal agreement, send data, or if you're partnering with a second or third agency, they can also send data through different channels without having to send to each other. We give those agencies a interface by which they can initiate the match and of itself. So in this case, we're minimizing the disclosure of client information across and whose hands it goes in. So it's in basically a third-party objective, secure platform that we've laid out kind of transparently with our data partners. We even try to make sure that we kind of even cut ourselves off from the platform when the match is happening, and verify that with our data providers too also. And then make it accessible so that they can run that match. And so what you hear on that is not only a privacy first approach, but we're also trying to build some efficiency. So also, and with this, provide sort of a standardized format. Alissa, Lorelle, to your points about the data, we know typically the data that we need for matching. So why not give a rules of engagement, kind of a standard format there. And so when we engage with agencies, we take all the guesswork out and say, here's the format, here's how it is, and here's how you engage with that platform. And so we've utilized it in a number of ways, and we're trying to evolve that even further to become even more virtualized, i.e., even having the lack of a need for physical storage of data anywhere. So the more we can evolve on that, I think the more we may not be able to answer every use case out there, but the fact is it has been effective and kind of coming over the hump of some of the more traditional kind of use case scenarios. And so really excited about that and really see that as a way to kind of move forward.
Thanks so much, Tayyab. I think, we heard over and over, you can do this work with an Excel spreadsheet, and some technology can be really helpful. So I think we heard both, but I think, we've seen really a proliferation of some of these technologies popping up in a lot of exciting ways to try to address these, as you said, kind of building technology around the core questions that folks are grappling with. So I think that's really, really exciting. Shavana, I'd love to hear, what role do you see equity playing in agency conversations around data sharing for analysis and outreach?
I truly believe that, at the center of everything we do, especially as public servants in the health and human services space, equity and data is at the front of every conversation we have here at the department. We are really looking at all of the client data, some aggregate level data to really get an understanding of what does the population that we're serving kind of look like? What are the barriers that, that they've actually experienced? We've actually done probably a year and a half ago now with all the staff or all the leadership staff that we have here in Louisiana at DCFS, a poverty data walk where they can actually see what poverty looked like through data that we received through partnerships and data sharing agreements we had throughout each of the parishes, which everywhere else I think they're called counties, right? But within our state, what does that data tell us? And it really, I think it really helps because it really allows us to meet people where they are and to understand where are resources needed and where are challenges that we have, and really have honest, open conversations about some of the policies and practices that we have in place as state agencies who operate these type of programs, and then also some of the challenges that that currently exist within the federal regulations itself, in which we can operate these programs efficiently, especially when it's one agency who's operating so many different programs. We speak a lot of, and we have a lot of conversations with a lot of other state agencies like WIC, like housing, on really trying to figure out how do we confer eligibility to make it an easier process for individuals to access the services rather than doing 10 applications, which are very similar, but maybe have one or two different questions on that application because it's very specific to the program area. And so we've worked very closely with our WIC office and with our housing department, especially during the pandemic, as they receive funding on what is the eligibility requirements that you all have, right, for those program areas, and where can we confer eligibility, enter into MOUs so that we can do data sharing agreements. And we did that a lot during the pandemic, and some of those MOUs will be standing even after the pandemic, which is really nice. We probably entered into at least, I would say probably at least 6 or 7 more MOUs where we were sharing a lot of data, trying to make it a more streamlined and efficient process for the participants who need it or the individuals who needed our services and our programs, so that we can try to help to get eligibility determined kind of right away. For example, when we worked with the Housing Authority, it was really a lot about our eligibility requirements in our programs are not as restrictive as they are for SNAP. So we know that anybody who is on SNAP would automatically be eligible for our program. So can you share that information with us, and how can that information be shared? And I think I heard Tayyab talk about the SFTs, the file transfers, and some of the challenges, and within that, and that is a real problem, I will say. It takes a lot of time and a lot of administrative work in order to get some of those things when we don't have systems that will talk and share the information. But what I appreciate is that there is a desire, and I think the pandemic definitely identified and highlighted the need that state agencies have and Health and Human Services to really get on board and try to figure out how do we do a better job in providing resources and support using data share agreements so that we can all determine eligibility, to reduce some of the administrative work that we have in order to get the eligibility determined. And every state agency is, experiencing challenges oftentimes in hiring and maintaining staff. So as we are losing staff, but the work is not changing and it's actually growing because the need that's out there right now, how can we use data and tools in order to treat people fairly, right? And make sure everyone has access to programs and ensure that we are doing it beyond just the programs that we currently operate with, but our partners and our friends in other spaces who are here to help the public when it comes to really addressing poverty and insecurity in our state.
Thanks so much. I loved hearing both your thoughts about how data sharing and understanding data can really help you illuminate the challenges, what they are, what the gaps are, and be part of the solution. So that's really, really helpful to hear. Lorelle, North Carolina DHHS recently partnered with UPenn's Actionable Intelligence for Social Policy to release a data sharing guidebook, which was, I know, a big win for the agency. So it would be great for you to tell us, what that means for your work, what changes you've seen as a result of some of these kind of governance systems being put in place.
Absolutely. So for one, it makes things a lot easier. So now that we have this new framework in place, so we've got the interdepartmental memorandum of understanding, and then we also have these data sharing agreements, this really helps us to break down those divisional silos to make data sharing easier. Because now each of the divisions, they have these DSAs and offer up, hey, these are the data elements I'm okay with sharing. And so it eliminates the need to do a lot of paperwork. It saves so much time. It helps us to get into data insights faster and helps program folks to also take action faster. And we actually had a colleague that tried to quantify the time savings with this new framework, and we found up to 90% of time savings, which is significant. And I can really attest to that, especially very recently, just a few days ago, we're actually trying to link a fourth data source with our cross-enrollment data. So with WIC, FNS, WIC, SNAP, and Medicaid, our NC Care 360 data. And so that's now, we're talking about 4 data sets across 3 divisions now. And it was, way easier than we anticipated. We were almost like, this is too good to be true, because we didn't have to do any additional agreements because of the DSAs in place. What we're trying to do, the reason why we're trying to join these data together, it falls under that general approved use to improve data quality and also to help us to reach our organizational strategic objectives. So yeah, prior to our new framework in place, that would have been a lot more complicated. And this also helps us with in terms of data quality, kind of going off your previous question about equity, this is also helping us, but more on the data side, because this NC Care 360 data set, we had a lot of missingness in terms of demographic data. So up to 40% of the fields were missing for race and ethnicity. So we can't do equity analysis with that data. But through data sharing, we're able to actually pull that in from Medicaid, for example, be able to fill that in. So that's also one of those benefits of data sharing. And it's beautiful that with all the time that I shout out to Amy Hahn Nelson from UPenn, who really helped spearhead this work. It was, I think Shavana was mentioning this, it's a lot of upfront investment and time to put it in place. And this started before COVID. COVID kind of delayed things. But now that we have it in place, we are definitely seeing the fruits of it.
That's amazing. That's really, really exciting. We have a section about how you sort of take something from, that first pilot and all the way up to kind of scaling and sustaining it. And what we saw over and over and again was things like, those data governance frameworks are so important, not just for kind of strengthening the work, but really an incredible time savings. And I know that's something that many of our agency partners today are really thinking about. So Tayyab, we'll have you bring us home with some, imagining the future. Imagine it is 10 years from now. What tools, systems, or supports do you think should be in place for data sharing that aren't available now?
Well, thinking 10 years ago, and kind of the things that we were not, or we're just kind of emerging on the horizon. And I think to the thought of like human-centered design, that concept, and now it's in civic service design has become so ingrained 10 years ago in a way that it wasn't. So my hope in kind of thinking and using that as a model is that you see on the horizon right now, and I think the Playbook has done a really nice job of highlighting this concept emerging that's been around for a while, but I think hopefully continues to take more traction around privacy preserving record linkage and privacy enhancing technologies, and thinking about privacy and technology is more than just encryption, data encryption. And it's more than just tech, in the sense, how do we kind of combine the goals and the outcomes that we're trying to reach here and bring to the technology approach as well. So I look at it in 2 ways that I hope to see kind of moving forward. One, just as I said before, continuing on with thinking about how we bring those approaches around privacy preserving record linkage and privacy enhancing technology more closer and front and center, and particularly in the health and human service space within the public sector and government arena from a technology point of view. But on the second area, I'm going to go back to the fundamentals. And if people who know me, I kind of know I'm a broken record with this. And I've probably been saying it for well over 20 years now. So, but I'm going to keep on, is that we have to go back to the fundamentals. There's, one, we collect a lot of information about data. We do a lot of MIUs, but the really kind of thing that happens oftentimes when we get into these conversations is, even though, one of the tips is don't start from scratch, we unfortunately end up starting from scratch. The kind of biggest innovation point that I often, I've just came out of a conversation Monday at kickoff, and I said, the most innovative thing we can do is just figure out that in 100 years of New York City and kind of in this social service space, people have probably asked this question before. And likewise, people have probably, convened around this and whatnot. And there's likely, data sharing agreements and whatnot. And the reality is everybody in the room agrees that they are. But we don't always, taking the time just to get those done is a big achievement, but also archiving them and making them shareable and, transparent to provide and let people know that there are legal precedent for this. This is the technology approach that we did to it. Here's the data that was used for this and what we learned and what was not useful. So my two areas are, kind of keep pressing on privacy preserving. And let's also kind of think back the fundamentals of how they kind of play and provide the efficiencies for data sharing. The hardest thing here should be the legal conversation, not sort of like where the data is again, or our tech approaches. So that's just my 2 cents on that.
I think the three of you collectively have already brought us forward significantly. Really bringing us into the future we want to see. So thank you for this discussion. With that, we'll stay on, but we'll invite Bridget Gibbons-Strawn back on, who can lead us through some Q&A.
Great, thank you. Thank you so much for that discussion to the panel. Really, really informative. And there are some really thoughtful questions coming through the chat. We've got about 10 minutes for Q&A. Like I mentioned, I was trying my best to keep up with the Q&As coming in. Some really good questions. I'm going to get to as many as I can. I've combined a couple just so we can try to speak to some of the broader themes coming through. And for anyone on the webinar who asked a question and we didn't get to it, or anyone who has a question after we log off, please don't hesitate to email us at partnerships.bdtrust.org and we can correspond after. Okay, so some of this kind of came out in conversations, but there was a question just asking kind of to lift up for the panel. What have been the biggest challenges to establishing data sharing partnerships and how have you overcome them?
I would say that the biggest challenges that I've had, especially recently, is making sure that we have the right people in the room who are actually making the decisions. All lawyers are not created equally, and all of them cannot speak on all things. And so we have experience, especially on the most recent data sharing that we've moved forward with, which is with Department of Health and sharing birth records so that we can use that to determine eligibility and relationship for SNAP and TANF programs. And some of the conversations were just that we didn't have the right people in the rooms who had authority after we did all this work. Nobody went back to question it. What was great is that we didn't start from scratch, and I think you all have that in your playbook as well, right? We took examples of other data sharing agreements that were already in place, who were already sharing information for these same purposes, and an existing data sharing agreement we had, and just updated it with some more language. But the challenge, the biggest challenge we have is just realizing that we didn't have the right staff or the right individuals at the table, and then how do we recognize who is the right individuals? I think, especially if leadership is very supportive of the direction in which the agencies are moving, those things kind of move through the process very quickly. We were very fortunate that we recognized that it wasn't the right person. I think we had a meeting the very next day, right, to try to make sure the right person was there and had the same conversation again. So we were able to move our data sharing agreement forward. We didn't have as many of the problems, I think, as Lorelle kind of talked about earlier, as far as making sure the fields where the data was coming on the right fields. And that was partially because we used existing data sharing agreement and existing fields and data points. And so we did some pre-research to figure out this is exactly what we want. So we knew what we were going to the table with. And so it was easier on the other side to say, okay, we've already done that. We know we can do it. It's not a systems thing. It truly is just a data sharing agreement thing that we have to get our lawyers at the table with doing on.
Lorelle, Tayyab, anything you want to add?
No, I would just add just a quick point to this is that in addition to, like, the city of New York is complicated by the fact that we are kind of governed by not only state law, but there's local and there's federal as well. And so there's a whole lot of actors that have come into play. So a +1 to Shavana having the right people in the room and being thoughtful about it. I will just add also kind of articulation of the use case and kind of how well that is stated, and making sure that when you're bringing the right people together, you know, everybody kind of knows what their objective is, but to be thoughtful about specificity around that, to be thoughtful around even sort of how you will measure impact around that, and to be thoughtful about how that begins to accord with the law and be adherent to the law.
Thanks, Tayyab. Our next question is kind of a two-parter. It's about kind of this topic of coordinating data sharing when you're working across partnering agencies and governments. So part one is for Lorelle. There's a question if you could explain a little bit further with the SNAP, WIC, and Medicaid cross-enrollment pilot that you are, or data matching that you have been working on. Were the 3 programs and divisions that you worked across organized within the same agency, or how was that set up?
No, they're not in the same division. So they're actually, SNAP and WIC are under one division, and then Medicaid is under another division. A little complicated, more complicated in the beginning when we were doing the data use agreement, because we were in the process of moving SNAP and WIC to another division. But yeah, it was under multiple divisions. And so through the DUA, we were able to contemplate that we had to actually add special language for WIC. But otherwise it was pretty straightforward from there.
Great, thanks. So building off of that, just if you or any other panelists have thoughts on this, if you can speak to any of the considerations folks should keep in mind when there are kind of different configurations for divisions and programs that are sharing data. So you kind of spoke to this a little bit, Lorelle, but again, depending on your setup, there might be different things to think through when multiple programs are participating in data sharing exercises.
I think one of the things that I've noticed in working here in Louisiana, and prior to Louisiana, I worked in Washington State, kind of work in the same space, is that most of the agencies who at least run the SNAP, WIC, TNF, SSI programs, a lot of those programs already have agreements to share federal information, because most times there are already relationships that are already built, federal relationships and federal funding that require that we share some information. So typically there's already some type of agreement in place in which we are sharing some type of data. It may not be the same amount of data or the same type of data, but there is always something that's already there. So the relationship is built. And so if you can tap into what's already existing and make your use case of why you need it to be something different, it does move a little bit quicker. And it's also great to also come to the table with, this is my problem, right? So have that problem statement and then that solution that you feel like this is the way that I believe it can be fixed. And then also, and I know it's been done here in these 2 programs, right? And we'd like to tap into those same things. So I've done that in Washington and also here in Louisiana, and it's worked fairly well. It's not as lengthy as starting over, which is great. And it usually is just more questions from the lawyers who are asking, how is the information being used and why is this information really needed? And oftentimes, at least in these spaces, it's really about eligibility determination or processing.
One thing I just want to add that we heard a lot of is, really finding shared value across programs and agencies, understanding that, different folks are going to report up to different leadership, have different priorities, but when you really focus on what is the shared value for both programs, that's going to be helpful, because if it feels like there's only one program that's ever really benefiting from, all the data sharing and all the time that goes into it, that may not allow you to really kind of scale and sustain the work. And so really thinking thoughtfully about that for both sides is, I think, a kind of a really important step. Seems
Thanks,
like
all.
we have time for one more, if we're lucky.
I think so, yes. Lorelle, I did see you come off mute. If there's anything you'd like to add to that last question, feel free.
I was just going to say that I completely agree with what Shavana was saying and what Alissa was also emphasizing in terms of really linking that, like what the why to the why are you actually doing this? And if you can connect that with like your department's strategic objectives, right? Because it's about improving food security for the state. So that was something that really helped us to be able to link it to that, and knowing that this was one of our secretary's top objectives in achieving. So that really helped to propel that forward and make that, data use agreement. It just took 1 month to do versus a year.
Awesome, thanks for that. Our last question here is wondering if the panelists can expand on how using data sharing initiatives and data with an emphasis on data governance can help pave the way for future opportunities. So how can doing this work well and right now pave the way for future opportunities?
I can say, so where I've seen it, I think within my experience, we've had a number of data initiatives that as we've done more and more of it, I think we have tried to kind of share through our office and our work that here's what the governance structure looks like. Here's how, be very transparent around that. Share it with data providers, particularly with lawyers, as well as program and technical folks as well. So that, I can't emphasize enough that a lot of this work, in addition to kind of doing good things, is relying on sort of a trust of partnership, trust of data partners, that, you will do what, we intend to, and we can accomplish what we intend to do. And so, the extent that, we can get a use case, it gets up and running, we can show that there is, what governance means, how that is. And then in particular, like what we try to do, it's often harder said than done, but as if we understand what the use case was attempting to accomplish, who the populations we were trying to reach, our goal a lot of times is to follow up on the outcomes of that use case and to share the outcomes back with the data providers to say, hey, as a result of this agreement and all this hard work, and yes, some of you were really excited about it, some of you were not so excited about it, but as a result of you doing this is how you benefited not only this population, but populations that you serve as well.
And I would echo what Tayyab said, because so much of, I think a lot of the challenges, especially in the health and human services space, is that we just don't do enough of telling our story of how well things are going and why they are going well, right? We know, and our disaster SNAP is a great example. We know that, we would never be able to do a virtual disaster SNAP if we didn't have data sharing agreements, right? If we could not verify relationship through the help that we had with our OTS and OMB partners, if we couldn't use, the Social Security information and data that we get from them in order to determine eligibility or use it for eligibility determinations. All of these data sharing agreements, if they weren't there, we couldn't do anything. And I think so often we talk about the success of the serving of all these individuals, but it all started because we have data share agreements in place. And I think we need to, when we circle back around to talk about the success, we need to really hone in on that and speak to that, because that really is the catalyst that moves a lot of the things that we're doing in these spaces when it comes to innovative approaches forward. That's really a lot of what's really helping us to strengthen this work so that we can do things better in the future, right? And so other states can also learn, right, on, oh, you're doing a virtual DSNAP type of model. Well, what are the steps that are needed? And they can tap into, okay, can I get a copy of that data share agreement? What was it kind of like? And a lot of, especially in the SNAP and WIC, and a lot of us are all in the same spaces. So it's easy to jump on a call like we often do for the state of Oklahoma, who is trying to enter into a data share agreement to share some of the same information to say, hey, this is how we were able to do it. This is who was at our table. We can bring those same people to help kind of move the process along. But I do think it all starts with being able to really champion that it's the data share that's really making a lot of these things happen.
Awesome. Thank you so much for all of your responses here. I will now pass things over to Jeneé to close us out.
Before we wrap up with a quick survey, we just wanted to let you know that BDT and the Center for Healthcare Strategies just released a great resource that includes survey results on how SNAP and Medicaid coordinate and share data. It's a terrific tool that builds on this playbook. You can check it out on our website. Excuse me. We want to thank our panelists for such a lively and informative discussion. And also thank you to all of you for taking the time to be here virtually with us today. And finally, we will close by asking you a few short questions. We'd really appreciate your input. BDT is gathering information about what resources and supports might be helpful to you and the audience around data sharing going forward. Thank you again.